Okay. Y'all, thank you for coming. Holly Mae, thank you for being here. As you know, and we thank you for coming, we want to be sure that everyone in the state is kept up to date with the latest information. So here we are to give you some information and answer questions. Dr. Rick Toomey of DHEC.
Thank you, Governor. Good afternoon. As you know, we are continuing to monitor and respond to possible cases of COVID-19 or the coronavirus in South Carolina. At this time, the risk of contraction of COVID-19 remains low to the general public. We, along with our state partners and public health officials around the state, have been preparing for the introduction of COVID-19 in our state. It is here, and our systems for limiting spread and caring for those affected are working. As an update from late yesterday, DHEC received a presumptive positive result for one additional individual who were tested for the novel coronavirus, COVID-19. Dr. Bell, in her comments, will provide a little bit more information. Currently, we are on the monitoring of patients. We have completed, we've completed 56, 16 remain in monitoring. Of those tested, we have 24 negatives, 7 positives of the 31 tests that we have conducted to date. With regards to the recent Richland District 1 announcement, DHEC did not advise students to stay home from school or self-quarantine. DHEC is not aware of anyone being tested. School districts should consult with DHEC prior to making decisions or announcements such as this. Governor?
Thank you. Today, we participated in a video conference with Vice President Pence, Surgeon General Jerome Adams, and Health and Human Services Secretary Alex Azar, whom we had conversations with before, to report on how Team South Carolina is responding to the virus. Healthcare authorities in South Carolina continue to follow established protocols and procedures to address the virus. There is no cause for public alarm or speculation. Schools will remain open. Schools will remain open. And state government offices in all 46 counties will also stay open. South Carolinians should continue their normal daily routines and responsibilities. It's important to remember that each individual, each of us, is responsible for their own actions and personal hygiene. That's for our own benefit, your own benefit, and that of the community. All South Carolinians should continue to follow the recommendations and information provided by the official sources, and you've all heard it and seen it over and over. Cover your cough or sneezes. Wash your hands with soap and warm water throughout the day. If you feel sick, stay home and contact your doctor. Or from home, you can do something in South Carolina. You can consult with a doctor for free with MUSC, that's the Medical University of South Carolina's online coronavirus website. And that is found at musc.care, musc.care. As of this morning, 1,178 people have logged on to that website and have been screened by medical professionals. Again, ours is the only state that we know of that has this free service. As DHEC has pointed out, there's no shortage of testing kits in South Carolina. Your local doctor or health care professional can get you tested if they believe it is necessary. It is inevitable that more South Carolinians will get tested in the days and weeks ahead, and it is likely that we will have more presumptive positive cases. For perspective, the Surgeon General told us today that the coronavirus has a lower threat of mortality with children and young adults than the regular flu does. That's what he told me today in the meeting we had earlier, the video conference. Elderly people with underlying pre-existing health conditions such as obesity, diabetes, respiratory, or heart disease, are particularly vulnerable to the coronavirus. We have seen that. Dr. Bell.
Thank you, Governor. Good afternoon. Late yesterday afternoon, March 8th, DHEC received a presumptive positive result for an additional individual who was tested for the novel coronavirus COVID-19. The older man is a direct contact, meaning he had close face-to-face contact with a previously announced presumptive positive case. He is also from Camden. He was evaluated at a healthcare facility. He is not hospitalized and is currently isolated at home. He was with these new presumptive positive cases, we now have indication of community spread in Camden. However, I want to reassure the public that DHEC has been preparing for the introduction of this virus in South Carolina for weeks, and we have planned, prepared, and tested our ability to respond to public health threats like COVID-19. Our contact investigation protocol is working, as we are appropriately identifying and connecting with individuals who could have been exposed to this illness. This helps us to limit potential spread while we continue to also identify potential exposures based on travel or other relevant history. It's all of our responsibilities to help prevent the spread of illness. Our key recommendations at this time are to stay home from work or school and to avoid public gatherings to protect others in the community if you are sick. Reach out to your healthcare provider if you are showing symptoms such as fever, cough, or shortness of breath. If an individual doesn't have a primary healthcare provider, MUSC Health is providing free telehealth screening to all South Carolinians. Anyone experiencing symptoms can visit musc.care and be screened without having to leave home. You can reach out to MUSC for more details on its telehealth screening. We're still learning about this virus, and we are committed to keeping the public informed. As we learn more, we will continue to provide updates as quickly and as timely as possible. I'd like to reemphasize that each of us has a responsibility to prevent the spread of disease, to protect our family, our coworkers, our community. Please stay home if you are sick and continue to practice good hygiene. I want to thank all of our public health officials, healthcare providers and healthcare facilities, and various leaders and groups across our state for their continued dedication to protecting the safety and health of South Carolinians. For the latest information, I encourage you to visit our website at scdhec.gov/COVID-19. Thank you, and I'm happy to take any questions.
Does anyone have questions?
Of course. In
Yes,
5
ma'am.
days, thousands of people are going to descend into 5 Points for St. Patrick's Day Festival. I know that right now we're saying to avoid crowds. What's the expectation there?
We're asking people to avoid crowds if they have symptoms. If we're in a community where we don't have evidence of ongoing spread, which is not the case in Columbia area, for example, so there's no reason to alter our routine activities. There's no reason at this time to cancel any public events or take any special measures when there is no evidence of ongoing spread in a community.